Welcome to the AA Podcast, our little corner of the web where we are not afraid to discuss tough questions like,
when did nutrition, health, movement, and stress management become alternative medicine?
Where we embrace challenges in all aspects of life to become healthier and stronger versions of ourselves.
And where food and movement are the best kinds of medicine, and cooking meals at home is a revolutionary act.
Hello, and welcome back to another episode of the AA Podcast. This is Ashley Olson.
And I'm Andrea Crane.
We are so excited about today's episode, but before we get into what it's going to be about, we will share our weekly Bible verse. And mine is coming from Psalm 21:4, and it says, "He asked life of you, you gave it to him, length of days forever and ever."
All right, mine is New Testament, Galatians 5:14. For the whole law is fulfilled in one word: you shall love your neighbor as yourself.
Beautiful. Well, Andrea, we got to have the privilege of speaking to Dr. Anju Mathur this week. And so this is obviously being recorded after the interview. And can I just say that, wow, she was just such a delight to talk to.
Yes, she is delightful. I think that is a great word to use for her. Just so full of life, so full of information. And I think you guys are really going to love this episode.
Yeah, we have her contact information in the show notes. Please definitely go check out her website. It's angellongevity.com, I believe. And then she does have Instagram, but she's not super active on there, but she does have some really great posts out to get familiar with her work. So today's episode is all about long COVID, and we definitely, after the episode, we reached out to her assistant and was like, if she ever wants to come back on the show, please let us know. And so she said she had a blast and wanted to come back on. So without further ado, here is our interview with Dr. Mathur.
Today, we are excited to have an expert with us who is truly making a difference. Today, we are thrilled to have a very special guest, Dr. Anju Mathur. Dr. Mathur is the founder and medical director of Angel Longevity Medical Center and a board-certified expert in anti-aging medicine. With over 15 years in general medicine, she recognized a major gap in healthcare, one that focused more on treating symptoms than actually restoring health. That realization led her to a pivot towards functional and regenerative medicine, where she now helps patients reclaim their vitality through natural hormone optimization, personalized nutrition, and holistic wellness strategies.
And with more than 12 years dedicated to anti-aging and longevity medicine, Dr. Mathur has helped countless patients navigate complex health issues. From hormonal imbalances and menopause to chronic conditions like Hashimoto's and chronic fatigue syndrome. Her expertise has even earned her recognition, I love this, in Suzanne Summers' book, I'm Too Young for This. Today, we're going to explore her unique approach to long COVID. I'm so excited for this topic, Ashley. I've been waiting for this episode. Let's get into it. Dr. Anju Mathur, welcome to our show.
Thank you for having me here in your show.
Yes. So today we're going to be talking about long COVID.
Yes. But before we get started, Dr. Mathur, could you give us a little detail about what you're doing? What does your clinic, what does that look like? And how do people kind of work with you?
Yeah, so my clinic, basically what I did was, as you guys mentioned earlier, was that when I was doing general medicine and family medicine for a few years, I realized that even though I was helping the patients, but I saw that the patients kept coming back with same problems over and over and over. And all I had to do was to just renew their prescriptions. And these were medications that they were never going to get off of them. And there is all this buildup of side effects. So I just realized that I wasn't really fulfilling my purpose of being a physician. That I wasn't really having this moments with my patients when they say, "Wow, I feel awesome, doctor." That never happened for many years. And I saw, there's something I'm missing here. I'm not really getting to the bottom of the people's what problems that they were facing in terms of their health crisis. And so I started looking for alternatives and started looking for answers. And of course, my own journey, I went through a similar situation of my own. And of course, when you are a doctor and you have your own health issues, then you kind of get to the bottom, try to get to the bottom of it as to what is happening. And I did. And I was like, okay, so little by little, I introduced different strategies, different treatment protocols in my office with my patients. And believe me, when I say this, and I would say, you know, I've never done this treatment before, and I've never been taught in the medical school about this,
Mm-hmm.
but I'm going to tell you that I think we can use this treatment to help you. And they will say, yeah, do whatever you can
Yeah.
to help us overcome our problems. So that really encouraged me a lot to keep looking and looking for the answers. And that's where what I do now. So I say that if you are interested in getting to the bottom of your health issues, then you should definitely look into holistic functional medicine
Mm.
because that's the way to go.
I love it.
Could not agree more. Yeah.
Yeah. Andrea had a similar revelation and how
Mhm.
she got into functional health too. So,
Yeah.
just all comes together.
Yeah.
Yes, yes,
Yeah.
absolutely.
Yeah. So, can you kind of explain? So, is your clinic? Do you do a lot of virtual, or do you do mostly in person?
Well, I do both. I do
Mhm.
both. Obviously, I prefer in person because there is a much better communication between a patient and the practitioner. And it's very interesting when you are together with the person in the same room.
Mhm.
There is a synergy that happens
Yes.
even between the patient and the practitioner. There is the insight that occurs as you speak with someone face to face. And so I love in person, but I also have patients, in distant parts, even outside this country, many
Mhm.
patients that are international. So I do virtual. But if you were to ask me, I would
Mhm.
say I love seeing the patients, giving them hugs. I
Mhm.
love doing all of that. So
Mhm. Oh,
yes.
that's wonderful. So, so Dr. Mater is based in California. So, if any of our listeners are struggling and in California, or it sounds like she does some telemedicine too. So, we'll make sure that all of her contact information is in our show notes. But now, without further ado, I want to get into my pet topic here, which is long COVID. And Doctor, I've been waiting to hear your to hear you opine on your thoughts about long COVID. And can we just start with explaining to our audience what this is? What does this look like? Like if there was a patient that thought they might be struggling with something like this, what might that progression look like?
Well, it's actually very interesting. Some people, like you said, they get COVID and they get over it within a week and they're fine.
Mm, mm-hmm,
And then there's people like this patient that I just took on a couple of days ago. Uh, Her name is Anne.
mm-hmm,
Uh, I would keep her last name confidential,
mm-hmm.
but she came in with this recurring symptoms of bronchitis,
Yeah,
asthma, wheezing, tiredness, completely cannot sleep,
yeah.
all these things recurrent. And she never had these problems. And she's like probably in her 50s.
Mm,
And she said she never had asthma, never had bronchitis in her life.
mm-hmm,
But since she had the COVID, which was 2 years ago, and
yeah.
she's been going in and out of the urgent care and the ERs and getting all the
Mm-hmm,
inhalers, the treatments so she can breathe. She this woman can't even breathe
mm-hmm,
like a normal person for last 2 years.
mm-hmm.
And I said, this is long COVID.
Yeah.
Your body's not getting over this virus. So my theory and what I've been studying and looking at the research is that the COVID virus, or in fact any virus can do that, including the COVID virus,
Mm-hmm.
that it actually infects the immune cells.
Mm,
So
hmm,
when it's
interesting.
infecting the immune cells, the immune system cannot work to protect the body from invaders, which is pathogens in
Mm-hmm.
the environment, and then it turns on itself.
Mm,
And then it cannot get over because now it's almost like an autoimmune
mm,
condition.
mm.
So it's
Interesting.
actually an autoimmune condition that you can call it long COVID. The person is not able to get over it,
Mhm.
and there's
Yeah,
obviously something wrong.
that's really interesting. I had not heard it described in that fashion. Do you do you gosh, I'm gonna get ahead of myself if I don't follow my outline. I have so many questions for you. Um, but are you seeing like neurological deficits? Are you see
Totally,
Yeah, I am too. Lots
totally.
and lots of cognitive issues with folks. So you are too. You're seeing lots of brain fog, that kind of
Yeah.
thing.
Yes, yes, and memory lapses, or
Mhm.
even neurological, like muscular,
Yes.
neuromuscular problems.
Yes.
People have muscle pains for no reason, and in fact, this brings me to this person that I treated about a couple of years ago, and he was only like 21 years old,
Mm.
and he had the severe muscle spasms
Mm.
and numbness in his extremities, in his legs and his arms,
Hmm.
and I was like, wow, this is long COVID, no
Mm.
question,
Yeah.
because all of this. Also, you have to look at the date coincidence, like when did it start?
Mhm.
And usually,
Yeah.
when you trace back the history of the person, it comes to the point where they just got COVID or the vaccine. We wouldn't go
Right.
to the
Yeah.
vaccine at this point, but the point is that when they get exposed to the COVID
Mhm.
virus, SARS-CoV-2, then they can go into this condition, which is almost like an autoimmune
Mm.
condition, and then they can't get over it because the body is attacking itself.
Mhm. Yeah, and I don't know if you've seen this, but within the last couple of days there was an Ivy League institution, I want to say Yale, that just put out a study on the COVID vaccine that it is they're now coming around to say that spike protein has been found in patients. I think they mentioned with a longevity of 709 days in the
Yeah,
body.
yeah,
And so it's that spike protein that is incredibly immunogenic, and like you're saying, the immune cells are just constantly in this state of readiness and inflammation, and it just becomes a condition with incredible chronicity to it. So
yeah.
yeah, yeah.
Absolutely. I mean, the spike protein just elicits a lot of immune reaction
Yeah,
from the body.
cardiovascular,
Yes.
neurological, like every and reproductive. Also, are you seeing a lot of like mast cell activation? Is that something that your patients are dealing with as well within the realm of long COVID?
Yeah, you mean like having hives or like
Yes.
allergies? Yeah. Oh,
Mhm.
yes. Like I said. So, what I understand from treating so many patients from very different things, what I realize is that even though you may have the same, for example, you have COVID virus or,
Mhm.
SARS-CoV-2 virus, or you have EBV virus in your
Yeah.
body, that different people can manifest different
Yes.
reactions to it depending on their susceptibility of various different
Absolutely.
body parts. So people who have cardiac, manifestations have more propensity, more,
Mhm.
they are more prone to having problems with heart muscle or heart, whatever it is that they are running into. So
Mhm.
I feel like not everybody is going to come up with a brain fog or
Right.
with the neuromuscular. Everybody, like this patient I just mentioned, Anne, she, I mean, I had not seen any patient with recurrent bronchitis with wheezing and asthma like symptoms
Mm.
for 2 years after
Mm.
COVID. So, would you think it's COVID? Is a long COVID? It's like, okay, well, she's just getting flu virus over and over. But I just said, no, this is
Mm.
from COVID. It's a
Mhm.
long COVID.
Yeah.
Unfortunately, I'm sure you're going to ask me this question down the line,
Mhm.
is what are the biomarkers,
Yeah.
right?
Yep.
What are the
Yep.
biomarkers for
Go
this?
for it. Go for it.
No, I'm just
Yeah.
saying that there is actually no particular biomarkers that I have found
Okay.
that would be. But what happens is my suspicion goes up when, even I'm telling you, even if I do like an antibody test
Mhm.
for
Yeah.
the SARS-CoV-2 virus,
Yeah.
and they are positive, I more propensity to think that, okay, this is a long COVID,
Mhm.
because
Mhm.
normally the antibodies will disappear within 90 days.
Right.
But if they persist, I think
Mhm.
it is long COVID, even
Yeah.
though there is no particular biomarker that has been designated to diagnosis.
Yeah. Yeah, and it seems to, there seems to be some, at least in my world, what I've seen is there seems to be some reactivation of Epstein-Barr.
Yes,
And there can be some reactivation even as something like cytomegalovirus.
yes,
So yeah, it's such a chameleon. I love the way you explain that. It's kind of goes after the weak link in the
yeah,
body.
yeah, totally. I mean,
Mhm.
EBV is another. So, like I said, any virus
Yeah.
that can attack the immune cells and hide inside the immune
Mhm.
cells and change how the immune cell responds to
Mhm.
a foreign body or invader that's foreign to the body, a pathogen
Yeah.
changes because of the infection that's occurred of the immune like T lymphocytes or all these different NK cells or natural killer
Mhm.
cells or whatever cells that are part of the immune system get
Mhm.
infected, whether it is EBV. The same stories with EBV. You
Mhm.
can have long like mononucleosis that you get when you're younger,
Mhm.
and then later on there is chronic reactivation of the EBV, and you can get into chronic fatigue syndrome,
Yeah.
fibromyalgia,
Yes.
various different things you can have because of that, the continuation of the virus in the
Mhm.
body and reactivation of it.
Yeah. Yeah. No, that's fantastic. So I want to talk a little bit about so we've kind of tangentially talked about all of these different symptoms that can manifest. Have you seen particular comorbidities or exacerbating factors that play a role in who might struggle with long COVID? So, for instance, people with preceding respiratory illness, are there particular comorbidities?
Well, what I see in practice, I feel like, I mean, except this young kid who was only 21 years old,
Mm,
I think most people that once they're past mid age, like middle age,
mm-hmm.
they're 40 years and older, they obviously have other issues, health related issues, age related issues that contribute to
Yeah.
them getting this autoimmune type of reaction to COVID virus.
Yeah. Yeah,
So,
just kind of living in our world
yes,
in
living in the
this.
world,
Mhm.
environmental toxins,
Yeah.
various different hormonal imbalances, whether you are a woman or a man, you
Mhm.
have declining hormone levels, and that predisposes you to get any kind of chronic, kind of a persistent condition.
Yeah. Yeah. Well, so do you think that this is a growing phenomenon, or do you see it going away? What have you been seeing?
Well, I don't see a lot. I mean, that I'm not focused. My practice is not just focused on COVID,
Mhm.
but our practice is focused on autoimmune conditions.
Oh,
And
great.
obviously,
Yeah.
yeah, obviously, COVID, I mean, long COVID is an autoimmune condition in my mind.
Mhm.
So it falls into that category. So I do see patients requesting treatment for long COVID, but
Mhm.
it's not like an avalanche. I think the avalanche is mainly of so many autoimmune conditions that is like an epidemic right now. Fibromyalgia is number one. Women suffer from fibromyalgia so much,
Mhm.
and people kind of don't pay attention to them. They kind of
Mhm.
dismiss them that they have a problem. And
Yeah.
so I have quite a few women. In fact, one patient that just came in from Louisiana, New Orleans,
Mm.
and she had to literally move in next to us, and live here
Yes.
for a few weeks to get over it. And she was trying to get over it for last 20
Mm.
years.
Yeah.
And she
Yeah.
was desperate. She was like, I have nowhere to go. I have
Yeah.
beautiful family. My kids are grown up now. They're boys. My husband
Mhm.
is great, but I don't have
Yeah.
a life. I just don't have a life.
Uh,
So,
That yeah, it's devastating. We've got so much chronic illness, and it's there's something with the immune system, immunoinflammatory or autoimmune disease that is just rampant. And I think this time, unlike any other time in history, it's just running wild. And it's difficult to stem the tide. Um, so. uh, Doctor, in order to give people some hope, out there who may be dealing with this. Are you successfully treating patients? And are there some strategies that you've employed that are bringing patients relief and healing?
Oh, 100%. I mean,
Mhm.
that's what I live for.
Yeah.
Um,
Yeah.
but so in my mind, by the time a patient arrives in a doctor's office,
Mhm.
the situation is pretty dire. I
Mhm.
mean, it's not fun. Nobody wants to get up and go to the doctor's office until there
Right.
was an absolute necessity to do so.
Mhm.
So when they come in, I definitely pay attention, and I want them to heal as fast as possible
Mhm.
instead of dragging it out. There is no dragging out. Let's just nuke it now, and so you can go on and live your life.
Yeah.
So
Yeah.
I am pretty aggressive in that
Mm.
regard
Interesting.
because I don't like to see patients suffer or anybody suffer for that matter.
Yeah.
And so we have employed lots of intravenous IV
Mm.
therapies
Mhm.
that really get to the bottom of the problem and reduce inflammation overall, improve the pro-oxidant by creating a pro-oxidant injury. It creates the more antioxidant system into going into action, so the body
Mm.
produces its own antioxidants because we
Mhm.
stimulate the body to create that
Okay.
environment. So that
Mhm.
helps that. And then most of our pro-oxidative treatments are also antiviral.
Mm.
So they
Okay.
actually, yeah, they denature the DNA of the virus.
Mhm.
And so the virus cannot replicate itself. So it is not rapidly propagating
Right.
while you're trying to take a vitamin or a pill.
Sure.
So
Sure.
I just, I feel like we got to be a little bit more aggressive in handling the
Mhm.
situation. Like this patient I was describing, she had a chronic EBV,
Mm.
right? She
Yep.
said the only time that she felt any better was when she was given antiviral vanciclovir
Mm.
treatment.
Mhm.
And so she was convinced that this is EBV.
Yeah.
And so obviously I said, okay, great. So, well, let's just handle the virus.
Mhm.
And that, in fact, goes for any virus that you can think of.
Mhm.
For example, vitamin C IV is the
Mhm.
best antiviral agent that you can have or
Yep.
employ for yourself. So
Yep.
I don't particularly care what category of the virus it is
Mhm.
because vitamin C doesn't discriminate whether it is EBV or COVID.
Yep.
Mm.
So,
Absolutely. Absolutely. Yeah, we have all of these all of these pharmaceutical agents that are, you know, precision, pinpoint precision, but really I find functionally speaking, we need a pretty blunt instrument like vitamin
yeah,
C that or like peroxidative stress
yeah,
that like you're talking about.
yeah,
Now, does that include some of the? I think I saw on your website that you offer like ozonated kinds of therapies. Is that kind of what you're speaking to here?
totally. So
Mm,
we employ lots of different pro-oxidative treatments. One of
mm-hmm,
them is ozone.
mm,
So ozone is another one. As you imagine, ozone is used in air purification
right.
for sterilizing, for making sure any bugs are killed, and even water filtration system, we use
Mm-hmm,
ozone. So
mm-hmm,
we know that the ozone is antiviral or
right.
any pathogen. In fact, you can have
Anti
bacteria,
anything. Yeah.
anti-pathogen. You want to
Mhm.
only kill the bad stuff, right?
Mhm.
So ozone. So I use ozone. So basically, depending on the person, obviously there's other little factors that you take into
Right.
consideration. But I mean, I love ozone. We
Mm.
have ozone sauna. We have
Oh,
ozone
wow.
IV. We have high dose ozone. We have a multi-pass, 10 pass, all sorts of ozone we have available. We have treatments called UBI, which is ultraviolet blood irradiation
Mhm.
treatments that combines with ozone. So all degrees and all types of pro-oxidative treatments that we employ
Mhm.
to stimulate, to get the body in that condition where it can heal itself.
And what's like the time frame are we looking at for healing on an average person with long COVID? Like I'm sure it can vary
Yeah.
immensely patient to patient, but what are you seeing as far as like if somebody were to come to you for long COVID, like what are they seeing in terms of like their time commitment?
I wouldn't think it will be too long. I don't think it'll be too long because we are employing intravenous, so it's pretty aggressive,
Mhm.
and that gets to the bottom of the problems pretty quickly. So I would say, like you said, is it's varied, but it can go from anywhere from maybe a couple of weeks to about few weeks,
Mhm.
Mhm.
and that way you can, and you, then once you do all of this, you don't have to worry about it coming back
Right. Right.
because you have strengthened the body's immune system itself.
Mhm.
So whatever happens later on, it's not going to be a recurrent issue for you anymore.
Mhm.
And that's why I love it, because like it just handles the situation.
Yeah.
Do you find that people, they get over the long COVID, but are they less susceptible in the future to other viruses too?
Yeah, I mean, like I said, it just doesn't. The immune system is built so that it can handle anything that is like a foreign invader to the body, which
Mhm.
includes all pathogens. So if you strengthen your own immune system, you are on the right track,
Yeah.
because you're not handling one, like she said, is a big pharmaceutical drugs are very precision, so they're going to only do one thing and they leave 99% of the problems unsolved
Mhm.
and only solving 1%, whereas we do the opposite. We do the 99% and
Mhm.
1% maybe not so, and so that way we are strengthening the body's own ability to heal itself,
Mhm.
so you
Yeah.
can't go wrong with that.
Yeah,
Yeah.
absolutely. I think resiliency is the key. We've got to increase an organism's resiliency to be able to survive in the world with everything that we're walking around in. Yeah, I hear you. I love your message. Yeah, this has been wonderful. So, just switching gears a little bit regarding functional medicine, you're very functional. I've heard you speak on you know menopause issues with women, hormone replacement therapy, and so you do a lot of things at your clinic. Is there anything that you're really excited about in the functional medicine space? Any, new treatment strategies, any discoveries, any repurposing of old things?
Yeah, I think the one thing that I'm excited right now, as you were speaking, that I'm
Mhm.
learning about
Mhm.
more in detail, more in depth, is peptides.
Ah,
Yeah.
we just yes, that's wonderful. That's awesome. We just started doing some podcasts on peptides.
Yeah,
That's yeah, it's great.
yeah. So I'm excited about that. I'm using, in fact, some of those autoimmune, like I've used in the past for
Mhm.
Hashimoto's.
Yeah.
I use peptides to complete resolution of Hashimoto's,
Oh, that's
and
fantastic.
yeah. So that is very heartwarming. I love it when the patients see that everything is negative, there's no more antibodies. It's just very satisfying.
Wow.
That's
So,
that's incredible. I truly believe peptides are the future of
yes,
medicine. Yeah.
yes, yes.
And are your patients responding well? Are they open to that kind of therapy? Not everyone is able to inject themselves. I think that's kind of can be a showstopper for for
That
some
is true.
people.
I mean, that includes me because I'm a little chicken when it comes to the shots, but I have to get
Mhm.
over it one of these days. But
Yeah.
I know there's research going on into making it intranasal
Yeah.
and
Yes.
being able to deliver it intranasally.
Yeah.
Sublingual, I'm not sure, but intranasal they
Yeah.
are trying to make it. So hopefully, let's see. There's a lot of research going on in that
Mhm.
area. So I'm
Mhm.
excited. But one point of caution, because I know what happens is that in general, people like population, they don't understand. They only know the word peptide.
Yeah.
They don't
Yeah.
know what is comes before that or after that,
Right.
and they think one peptide is same as the other and the other, and
Mhm.
they kind of get kind of taken for granted, thinking, oh, they're going to say peptide. For example, I'm sorry, but I'm going to say it. Is semaglutide,
Mhm.
right? Is
Yep.
a peptide.
Yeah.
Yes.
People
Yes.
think, whoa, it's a peptide. I want the peptide.
Right.
But
Right.
there is a difference between natural peptide and a synthetic peptide. So
Yes.
I'm very careful when I'm studying something. I want to make sure it is aligning itself to the
Mhm.
body's own ability to heal naturally.
Mhm.
So I'm
Yeah.
only studying about the peptides that are natural to the body, not anything synthetic.
Interesting. Okay. Yeah. Yeah, no, and we've done a couple shows on semaglutide, tirzepatide, the latest retatrutide. There's a lot of in the pharmaceutical research pipeline,
Yeah,
because these are blockbuster drugs, right? There's a
that's
lot
right.
of money to be made.
That's right.
Um, so yeah, no, gosh, I could talk your little ears off about peptides. It's such an interesting area, and it's so avant-garde right now. There aren't a lot of people who can speak with a lot of knowledge about it. There's not been a lot of research, at least
Right.
not sanctioned research about peptides. So
Yeah,
yeah.
that is true. But again, like I said, if there is a synthetic, so you want to know if you're going to use a peptide,
Mhm.
you want to know from your doctor, is this natural or is
Right.
it synthetic to the body? Not that it is made in the lab, because you would expect a capsule to be made in the grass. Obviously, it's made
Right.
in the lab,
Right.
right?
Right.
It's not like, is it
Yeah.
coming from the plants? I'm sorry. Yes, it is, but it is made in the lab.
Yes. Yes.
So when it is made in the lab, it could
Mhm.
still be natural to
Right.
the body, because
Mhm.
this is why the bioidentical hormones, like for example, comes that word comes from that. The reason is because it's not natural
Mhm.
to have a human hormone in a plant, for
Right.
example, because
Right.
it doesn't make common sense to think that, oh, the estrogen is going to be in a plant, or let's say yam, right?
Right.
It's not. The yam doesn't need human estrogen, right?
Right.
So I'm just
Mhm.
saying that people kind of need to distinguish and differentiate that there is synthetic peptides which are synthetic to the body's own
Mhm.
normal biochemistry and physiology.
Yeah.
It's not part of that. It's different. It's synthetic. It is only, it's just,
Yeah.
anyway, it's just man-made. It's a completely synthetic molecule to the human body, so the human
Right.
body really resists it,
Mhm.
and it doesn't make you heal, in fact, from
Right.
inside.
Yeah, and you know what? To speak to that distinction, yeah, as you're talking, I'm thinking about synthetic forms of progesterone, like medroxyprogesterone, and the all of the problems associated with that, like with Women's Health Initiative study results,
Yeah, yeah,
and all of the things that came from that, but then there's also this air quote natural side where you can extract things like a conjugated estrogen from pregnant mare's urine, right? We used to use
yes,
that for estrogen, and
yes.
I think pharma kind of build that as a natural source, if you will.
Wow,
Um
really?
yeah.
Wow.
Oh,
I didn't know it was they put it as natural, but it's not natural to the body, to
no,
the
it
human
isn't.
body.
It's horse estrogen. And it's in a conjugated form, and
Yeah,
that is what has been tied to negative pathophysiological results,
that's
and
exactly right.
and why a generation of women were denied hormone replacement therapy. So yeah, we
Yeah.
do have to be careful. I definitely hear that message. Yeah.
Yes, yes, it's very important, because people can be taken for granted. They don't understand the difference, so
Mhm.
they just jump on the bandwagon of peptides. Or
Right.
even my friend, she says, Andrew, I'm taking this weight loss thing. I'm like, what are you taking? She says, oh, I'm taking this tirzepatide, and I'm like, what? No, don't stop now. She said, oh, okay, okay.
Yeah.
Because they
Yeah.
think it's peptide, so it's great. Peptide
Right.
is the latest rage, like you said. So it's
Yeah.
like, what?
Yeah, there are always positives and negatives to all of
Yeah,
these things, and that has to be considered for sure. So, Dr. Anju, so how do people work with you? Can you see people from across state lines? Do they need to come and establish with you in person?
yeah, they do. They
Mm-hmm.
do need to come in and establish a
Mm-hmm.
patient doctor relationship, and then we can
Yeah.
go from there. But
Yeah.
yeah, like I said, this patient just came from Louisiana. She's even moved close to the office, so she's living here. And now,
Mm-hmm.
I mean, now she just went back because she's completely fine.
Oh,
She
amazing.
recovered and she's living her life. She's gonna be on my video shoot next week.
Oh,
Oh, that's
So
awesome.
wonderful. Wonderful. Yeah,
Yes.
I would also like to know, Ashley, you're better at the tech part of this, but what do we need from her? We need, do you have like a YouTube channel or something?
Are you active on social media, or where can people kind of follow you and get more information?
Well, I think I try to put everything on my website.
Yes.
So
Okay.
you can go to
Okay.
angellongevity.com. That's the best way to get in
Okay.
touch with someone in the office and practice, and they can walk them through what are the requirements to become a patient,
Okay.
and so on. So yeah, I am on social media, but not that much. I just
Okay.
started doing it, the podcast now.
Mhm.
But
That's awesome.
Wow.
Well, we will link all of your information for your website and anything else in the show notes. But this has been
Mhm.
awesome, and thank you so much for your time today.
Of course, of course, a
Yeah.
pleasure, pleasure. Very nice speaking with both of you.
Well, thank you
Yeah.
so much.
Yes, you as well. All right. Well, you take care. And yeah, if there's ever anything that you think is on the cutting edge that you're excited about, hit us up because we'd love
Uh,
to have you back.
oh, thank you so much.
Yeah,
Pleasure.
Thank
of
you.
course. All right.
Bye.
Take care. Bye bye. The content provided in the AA podcast is intended for informational and educational purposes only. The podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The information and opinions expressed in this podcast are solely those of the individuals involved and do not constitute medical advice.